Hello, good morning. My name is Rebecca Garino, and this morning I'm going to talk about 3 hemorrhagic fevers: yellow fever, dengue fever, and Lassa fever. We're going to start with yellow fever. The image on the left is a computer-generated image of the yellow fever virus. It is in the family Flaviviridae, the genus Flavivirus. It's an enveloped, positive-stranded spherical RNA virus. And there are 40 flaviviruses associated with human disease. The word flavus is Latin for yellow. Yellow fever is historically significant. It has been around for a very long time. It was first identified in 1648 in the Yucatan, but scientists believe that it's been around at least 3,000 years longer than that based on the genome. In 1898, after the Spanish-American War, a commission was established by the Army, headed by Dr. Walter Reed, to investigate yellow fever in Havana, Cuba. The commission tested the theory of mosquito transmission, which was a completely novel idea at the time, through self-experimentation, which means 2 of the men on the commission allowed themselves to be bitten by infected mosquitoes. Both of them became ill with yellow fever, and one of them died of yellow fever. So that was enough evidence for them to take action in Havana, Cuba, to try to contain the infection. So they destroyed mosquito habitats around Havana and did reverse quarantine of yellow fever patients, which means they took all of the yellow fever patients and put them in a hospital tent and covered them with mosquito netting so that the mosquitoes couldn't get to them to then spread the disease to other people. And within 1 year, yellow fever was eradicated. They later went on to characterize the organism responsible as a newly discovered group of infectious agents, a virus. And the last major outbreak of yellow fever in the United States was in 1905, and that was halted largely to vector control. So when Dr. Walter Reed first brought back this idea of the mosquito being the vector that was transmitting this disease, people scoffed him at first. They did not believe him. But in New Orleans, they responded to this outbreak in 1905 by controlling the vector, and since then it's pretty much been adopted as, people understand that it is a mosquito-borne illness. So on the left, you see a picture of Dr. Walter Reed. There are 200,000 new cases of yellow fever annually, and that's globally. That results in 30,000 deaths worldwide. Yellow fever has a primate reservoir and a mosquito vector, specifically Aedes mosquitoes, including Aedes aegypti and Aedes albopictus, but mostly Aedes aegypti. Yellow fever is transmitted from the saliva of an infected mosquito into the human epithelium, where it's believed to invade macrophages. With all 3 of these hemorrhagic fevers, there is some ambiguity with the mechanism of action, but I just wanted to highlight some details of things we see with pathology of this disease. So within 24 hours, the virus is proliferating in infected macrophages in the liver. Infection and degeneration of hepatocytes occurs late in the infection. Hepatocyte apoptosis and fatty change of renal tubular epithelium is seen without inflammation in yellow fever. And hypotension and shock probably are due to cytokine dysregulation. Excuse me. There's 5 distinct phases to yellow fever. The first phase is incubation, which lasts 3 to 6 days. And in that phase, the patient is going to have no symptoms. The second phase is invasion, and that lasts 2 to 5 days. And then we'll see fever and chills. We'll see intense headache, low backache, muscle aches, nausea, extreme exhaustion. But the two distinguishing features of yellow fever, because a lot of these other symptoms are flu-like in nature, are a white furry coating in the middle of the tongue with a swollen reddened margin, and faggot sign, which is a high fever with a slow heart rate. So clinically, we often see a high fever with a high heart rate. With yellow fever, you're going to see a high fever with a slow heart rate. Phase 3 is remission. The fever falls. Symptoms decrease in severity for several hours to several days. And for some patients, this is the end of the disease. For others, about 15%, they go on to the intoxication phase, which lasts 3 to 9 days. And this is the most severe and potentially fatal phase of yellow fever. We see a degeneration of the kidneys, liver, and heart. Jaundice, black vomit, and proteinuria are signs of intoxication from yellow fever. The 5th phase of yellow fever is convalescence. People who survive intoxication enter into a relatively short period of convalescence. They recover with no long-term effects, and they obtain lifelong immunity to the yellow fever virus. So when making a diagnosis, the first question we're going to ask is, has the patient visited an endemic area? And we're looking for that classic triad of symptoms. A sudden onset of symptoms, which are flu-like. We're going to look for faggot sign, which is that slow heart rate with the high fever. And we're going to look for that white furry tongue with the red margins. We can use blood testing to detect virus-specific IgM and neutralizing antibodies. So most commonly, yellow fever is found in men between the ages of 15 and 45 who work outdoors and live in endemic areas. I remember hearing stories about when Teddy Roosevelt finished the Panama Canal in Panama, that there was an outbreak of yellow fever there. And that's the perfect example of a situation where you would see people contracting yellow fever because it's men working hard outside in an endemic area. It's endemic to South America and Africa, but not Asia. Ethnicity and race are not a factor in transmission. And there's 3 epidemiological cycles. The first cycle is the urban cycle. So that's where we're seeing yellow fever transmitted from person to person through mosquito vector. The second cycle is the sylvatic cycle. And that is when it's transmitted from primate to primate through a mosquito vector. And the third cycle is the savanna cycle. And that's that cycle that makes that connection between the primates in the jungle, mosquitoes carrying the virus from the jungle to the urban areas. So from the primate to the human. Treatment for yellow fever is mostly supportive care. People should rest. They should drink lots of fluids. Fevers should be treated with acetaminophen, not aspirin or ibuprofen, which could increase the risk of bleeding. If the patient hemorrhages, they may require a transfusion. Kidney damage may require dialysis. But luckily, like I mentioned before, that if they recover and they enter the convalescent stage, there's no long-term effects from yellow fever. Prevention. If you are going to travel to an endemic area, you should get the vaccine because there's a very effective vaccine, yellow fever vax, that is available. The reason why yellow fever is still endemic in these countries is because people are not vaccinated. Perhaps they don't have access to the vaccine. So in the last several years, the World Health Organization has had mass vaccination campaigns in areas where access to the vaccine is limited. Next, we're going to talk about dengue fever. Dengue fever is in the same family as yellow fever. It's from the genus Flavivirus. It's an arbovirus, which means arthropod-borne virus with a mosquito vector. It has a human reservoir, so it's the only flavivirus that is not zoonotic. And there's 4 distinct serotypes of dengue fever. dengue 1, dengue 2, dengue 3, and dengue 4. Mechanisms of hemorrhagic fever are unknown. Replication begins when the virus attaches to the human skin cell. Pathogenesis is complex and not completely understood. And let me adjust what I said about the human skin cell. They actually, it's believed, the hypothesis is that they infect Langerhans cells, they infect possibly dendritic cells and macrophages. So they infect immune system cells and then get into the blood, travel throughout the body, through the blood and the lymph, and then create all of these side effects because of traveling through the blood and lymph to affect the rest of the body. And that's the same with yellow fever. It infects a white blood cell, and then the blood is used like a highway, and it travels throughout the body to the liver, to the kidneys, to these other very important organs. So the pathogenesis is complex and not completely understood. The human immune response plays a key role. The most significant protein is NS1, which correlates with disease severity. And NS1 initiated release of cytokines contribute to endothelial hyperpermeability and vascular leakage. Dengue fever symptoms, 75% of cases are asymptomatic. 20% are symptomatic and non-severe, and only 5% are severe. So if you have non-severe dengue, you're going to present with a high fever, or the patient's going to present with a high fever, intense headaches, nausea and vomiting, pain behind the eyes. A rash develops third or fourth day, or swollen glands, slight nose and gum bleeding, extreme muscle, joint, and bone pain. And it's also known as breakbone fever. And as a side note, my father actually had dengue fever about 20 years ago, and he said the fever was extremely high and there was nothing you could do to bring it down. So like when you have malaria, he was saying how your fever will go up and then it'll crash and then it'll go back up again. And he said no matter what he did with dengue, he could not break that fever. He even took a bath in ice water and it would not bring the fever down. It can progress to dengue hemorrhagic fever. So as temps return to normal, about 5% of patients develop dengue hemorrhagic fever, also known as the critical phase. It lasts about 24 to 48 hours, and it's a phase where the capillaries become more permeable. The degree of plasma leakage varies, but it can be clinically significant, leading to hypovolemic shock if the patient loses a critical amount of plasma. Symptoms of dengue hemorrhagic fever include drowsiness, irritability, severe abdominal pain, nose or gum bleeding, persistent vomiting, vomiting blood, and black tarry stools. Dengue shock syndrome, also known as DSS, is vascular collapse because of the severe drop of blood pressure. Up to 30% of patients with DHF or DSS die, and children are most at risk because they're less able to compensate for the loss of fluids. Convalescence from dengue fever, most people will suddenly and spontaneously improve, and recovery provides lifelong protection from one serotype. Diagnosis, the first question, of course, like all of these diseases, is have you traveled to areas where dengue is endemic? You can do a PCR blood test within the first 5 days of the onset of symptoms. If it's after the first 5 days, you can do an IgM anti-dengue test, but that could possibly pick up other flaviviruses as well, so it's not as accurate as the PCR blood test. Treatment includes, just like yellow fever, supportive care, fluids, pain relievers, acetaminophen. With severe dengue, you may need to maintain fluids and avoid anticoagulants. Dengue is endemic to Central America, Africa, and Southeast Asia. There's a greater risk of contracting in urban and residential areas. And risk factors include a second dengue infection with a different serotype. So if you're infected with dengue one time, you are protected from that serotype of dengue for the rest of your life. But if you get infected with dengue again with a different serotype, you're much, much more likely to become ill with DHF or DSS. So it's very dangerous to incur a secondary infection with a different serotype. Prevention includes sleeping under insecticide-treated mosquito netting, wearing loose clothing that covers your arms and legs. Insect repellent should be applied to exposed skin day and night. And vector control, in the past, we've used insecticides, which is falling out of favor right now, but covering standing water is a good method of vector control. The Pasteur Institute is doing some research into Wolbachia, which is a natural bacteria that kills mosquitoes without harming humans, as a means of vector control. Currently, Dengue vaccine is only available for patients who have already experienced primary infection, and that is because if someone gets the Dengue vaccine without having a primary infection, if they get infected by a different serotype after receiving the vaccine, it could lead to them having dengue hemorrhagic fever or dengue shock syndrome because your body is treating it as a secondary infection. So there's only vaccines available for people who have already had an initial infection with a serotype of dengue fever. All right, and the last hemorrhagic fever I'm going to talk about today is Lassa fever, which belongs to a completely different family, and it's transmitted in a completely different way. It is an arenavirus belonging to the family Arenaviridae. It has 2 single-stranded RNA segments, one small and one large, and it is transmitted by the West African rat through excrement and urine. After it's contracted by humans, it can be spread person to person through a human host. And that's through body fluids, so it would be blood, semen, mucus. It's not an aerosol. It's not an aerosolized virus. Disease mechanisms, just like yellow fever and dengue fever, are poorly understood. Humans often die without bleeding, and histopathological lesions are not severe enough to explain organ failure and death. There's some macroscopic changes that we can see. There's pulmonary edema, pleural effusion, ascites. The liver is the most commonly affected target organ. I'm going to hit on a few high points that we see in people with Lassa fever. There's suppressed platelet and neutrophil function. There's possibly a cytokine expression similar to what's seen in sepsis involved in the pathogenesis. Virus-induced immunosuppression may play a role, and 80% of infections are mild or undiagnosed. But the fatality rate of severe Lassa fever is between 15 and 50%. Symptoms of Lassa fever. There's an incubation period of 3 to 21 days, and the symptoms we see are fever, fatigue, hemorrhaging, unexplained hemorrhaging, vomiting, diarrhea, cough, chest pain, dyspnea, disorientation, seizures, and unconsciousness. We diagnose this by recognizing the signs and symptoms. And again, the key question is, have you traveled to the endemic area? Do you have a history of contact with excrement or urine of rodents? Is there a history of contact with a person with confirmed Lassa fever within 21 days of symptom onset? Is there inexplicable bleeding or hemorrhaging? And then finally, blood samples should be taken, and lab confirmation is done by RT-PCR testing. I just wanted to mention too, with Lassa fever, contact tracing is very important, which I mentioned in the last slide. But we're going to look at who that person has been in contact with. We're going to see if they have any family members who have contracted Lassa fever. And you're looking back 3 weeks, you're looking back 21 days to that contact tracing. And then you're gonna consider their environment and whether they've been exposed to the West African rat. It's endemic to West African countries of Benin, Ghana, Guinea, Liberia, Mali, Sierra Leone, and Nigeria. The peak of Lassa fever cases in Nigeria are observed in the dry season, and that's because it's similar to our winter, where the rats don't have as much food outside that they can access. So they're going to be coming into human homes looking for food and getting into the food stores of African people. Treatment, as far as treatment is concerned, ribavirin is effective in reducing mortality rates from Lassa fever. Besides that, we offer supportive care. There are no vaccines for Lassa fever, and ribavirin is occasionally used as post-exposure prophylaxis. The best prevention is to avoid contact with mass to miss rodents, to put food in rodent-proof containers. Eating rodents is not recommended, and I know that might sound disgusting to an American palate, but in Africa, it's not uncommon in that region for people to cook rats. So, we're discouraging eating those rats. Isolation precautions are, necessary when caring for patients who have Lassa fever, and vaccine research is currently in process. So here's my list of references, and thank you so much for joining me for this presentation. Have a great day.